Hi, Katelyn. Thanks for joining me.
Hi, Walt. So good to be here.
Yeah. These peer-to-peer videos have been really pretty popular in terms of viewership as well as the feedback from, well, people who've been actually using the work for a while, kind of revisiting some of these topics, but especially for I call them newbies, right?
Yeah.
People who aren't used to using this at all. So, could you just take a moment and just introduce yourself?
Yeah. My name is Katelyn Swiader. I'm a speech language pathologist, and I have a background in professional voice. I was pursuing to be a singer myself for a long time, specifically in opera. I've taught in the public school system in arts programs, and over the years, I got fascinated with the science of voice and pursued speech language pathology. Now I have my own practice, and it's called Sound Waves, and we focus on coaching the professional voice for efficient communication, confidence, and also rehabilitating the singer and working with individuals who want to strengthen their skills. And then I'm at a hospital a few days a week where I am their singing voice specialist for
Got it. And you're
therapy
based
with
out of you're
laryngologists.
there you go. You're based out of where?
Norfolk, Virginia, and Virginia Beach.
Got it. Great. And Caitlin, just you helped me with my last class that I just taught down in Norfolk a couple weeks ago. So it's good to see you
Yes.
again. Um, and you know what? When did you first taste the class? I don't recall.
I took it in 22. I took it
Okay.
in 2022 in New York City,
Hmm.
and it was a wonderful experience. It was obviously one of the first things I did right after COVID for CEUs. And I have to say, of all the CEU courses I've ever taken, I was so impressed how quickly I felt I could apply the work that we did, and how I was very impressed with how much I was maintaining and retaining over these past 2 years. So it was wonderful that never have I taken a CEU course that I felt that I could just go apply, and then years later finding that I was still on the right track. So,
Nice, nice. Just last night I did a webinar with the Voice Foundation Southern California chapter for their quarterly meeting, which was a lot of fun. But a question came up there that I see quite often. It doesn't get asked as much to me, but I see it in general. Um, the criteria, like so many interventions, so many models. There's specific criteria to choose. Okay, who's the appropriate patient
mhm.
for this intervention or for this approach? And I was asked that last night, and it's almost it's a question I really struggle with myself
Yeah.
because I'll never know if anybody is amenable to touch and might benefit until we try it. But I understand, speech pathologists, there were speech paths and a few laryngologists at the meeting. And I understand that sort of the branches of a tree type of a concept. How do you approach things like that? How do you choose?
Well, some of my biggest breakthroughs came from being a performer who now has gone into helping people in intervention. And being able to switch between the professional singer on tour to the new singer, then also the rehabilitating voice user, all in the same day, over a year of having my own practice, I just noticed that there's a constant five things that people are always trying to overcome or work through. And I made a method, and through the method, body is pivotal. And I had a breakthrough when I was laying on a table having this manipulation in one of your courses, and I was singing notes I've never thought I could have had. I was singing the
Hmm.
Queen of the Night, like, and I just was like, wow. And I did that while someone's hands were on me. And that showed me that what we could have spent years at a university trying to achieve could have been resolved if we resolved our muscle tension.
Hmm.
So, if an individual has the skills, but there's something that's holding them back, and for me, I have a hierarchy. I have fundamentals. It's your breath and your body. They basically go together, and your mind is part of your body in my approach. So, is it anxiety? Is it like limiting yourself? But I'll instantly address the body instantly. And sometimes I usually do like body relaxation moves of like releasing tension from the head to the toes. But I will put my hands as I feel appropriate with my background, that I'll put my hands on them, or I will hear and assess that they have tongue tension, or I will even see tightness or squeeze. And if they aren't getting the concept to relax, then I will provide intervention. And I will ask, when you sing, what do you feel?
Mhm.
And if they tell me things that hint towards strain or discomfort, well, strain is usually because it's a physical contribution, not like an aerodynamic contribution for tension. So
Right,
I'll do that.
right. Great, great. Um, how about incorporating that? You said you had some early breakthroughs just being right on the table, but how did you find it difficult to begin incorporating this in with your clientele?
I have not, because I have found such, I really believe that if you see value in the work that you do, I always give individuals choices. I say that their voice is their vehicle, and I'm a GPS. So I will give them options. I'm like, you do not have to do the things that I'm suggesting. So if, for example, I'm seeing lots of jaw tension, that will probably be one of the first ones that I'll bring in before we do kind of things like this. Um, or just showing them some of the tongue moves.
Hmm.
And often when I recommend it and we're using it, we'll decide there, was this beneficial? Was this not beneficial? We'll move on. And often I have people that just come in after a show and they're like, can I just lay on the couch and you just do this for me, like for the whole
Hmm.
time? So yeah, it's pretty
Nice.
easy to incorporate, especially if you're working in some of this region. I find so many people to benefit from that.
Yeah. Any tips for the newcomer?
I'd say when it comes to voice specifically, look at them. Look at them during the actions. And if there looks like discomfort or withheld or decreased range of motion, go put your hands on if they're okay with it, and ask them, how is their experience? Like, is this familiar? And
Yeah.
really explore that with them. And if they don't want you to put your hands on them, I also find it very beneficial. And I have some virtual clients that they'll just put this here and be like, oh my gosh, there's my headache.
Yeah.
I'm like, okay, and then we'll work on deep breathing while they're there. And then after just a little while, and they could do it intraoral or externally, like however they feel comfortable. Because to effect, it's targeting the region.
Yeah. I absolutely love hearing other people describe to me how they sort of interpret the work from the class, and not just as that standalone treatment, but how each person chooses to blend it with their existing beliefs, existing training, and all those things. And to me, that's exactly the blueprint that I lay out in the classes, not just to create a bunch of mini-me's doing exactly, here's what we need to do in this order with these words. It's like, here's an idea, and I want you to run with it. It sounds like you really ran with it really well.
Yeah. And I've always been a fan of the collaborative team approach. One of my favorite settings to work in was inpatient rehab, where physical therapists, occupational therapists, and speech therapists were all working together. So even though I do a lot of private work, I will refer to physical therapy, maybe have some dry needling. If I see that their posture for breathing cannot be sustained, then I will encourage them to go out and get the physical, anatomical, structural support, because maybe that tension is because they're overcompensating, not having the support in other body parts.
Right, right. That's one thing that I often I feel is a bit of a shame that I think a lot of SLPs who this course is sort of targeted toward um, feel like they often will defer to physical therapy, for instance, for the manual interventions or some
Mm,
of the other things, which I totally get, especially in the hierarchy of a lot of rehab type facilities, and maybe even in your education and training. But it just there's something that's being missed, I think, when the SLP from your training, from your perspective, applies manual therapy. It's going to be very different than, well, when a PT or an OT or a massage therapist does it. not necessarily better, right? But the context, right? The frame of reference
Yeah.
is so different that I just, it's so approachable within your scope of practice that why would you defer? Why would you pass it off to someone else?
Well, you and I had kind of this discussion that the person is like a web. Like they're in the center of the web, and then there's all these different components that could be applied to contribute to it. Say if you go to physical therapy for some respiratory core training, but then you go to the voice therapist of how to apply, utilizing that support with the airflow and the tone, and then also the manual therapy to relax all of this area. But those webs are still connected. But the
Hmm.
person is in the center, and we're all working to solve one thing, helping them be more functional and successful with what they're trying to do with the least amount of discomfort and strain. And we all see the center, the client, from a different perspective, but we're all interwoven.
Yeah,
And so your approach versus my physical therapy counterparts, they're going to be thinking of it as, well, you see it and you say, oh, I didn't see it from that perspective because I don't have that background. But I'll
yeah,
be like, oh, I know that strain and tightness that people tend to have when they sing that higher note. Now when you applied this, all of a sudden it dissipated, and you had breakthroughs in the session that you gave in Norfolk, like actual tears. Someone was like, it's hurt for for over a decade. And then you
yeah,
did that, and you and I kind of co applied and was like, can you do a slide up? And then she's like, oh my gosh. So you saw it as a body, and I'm not going to put words in your mouth, but you saw it from the body release and relax and reducing tension and discomfort and maybe a muscle pattern of strain. And I saw it as kind of the speed bump getting in the way of her anatomical structure getting to her desired target.
yeah, yeah. And we
So,
all use sort of like metaphoric concepts to explain it, even though a lot of times, well, in the manual therapy, it always was about the issue in the tissue, not realizing that those issues are not just in the tissues, right? It's in the person. Um, and was that at all difficult for you to incorporate, or did you get pushback from any peers, from any other people in your rehab department, for instance, from wanting to come back and do this work?
no, the laryngology team actually are huge fans that I provide this because they can only do so much intervention themselves with like
Yeah,
surgical or injections. And then I've had colleagues that have applied work with individuals, but just the component of the whole body, I really value that when I've applied some of these techniques, they're like, that's different. And even though they're doing the exercises that they've been trained before, knowing that the house of their sound is been kind of manipulated in an uncomfortable way and it has kind of been staying there, when they release that, now the exercises can really be free. So I've
right.
gotten a lot of support. But in the other placements that I've been, because I've had inpatient, outpatient, and this practice that I'm part of, and my own private practice, it's really, I believe, an insurance thing. Because if the OT is doing this kind of care, but the SLP is doing it too, but for a different approach, some insurance will be like, no, you're doing the same work.
Duplication, sure. Yeah,
Duplication of a bill. So
yeah,
I would have to talk with a physical therapist and be like, "Oh, are you doing this because we can't both charge for it?" Now,
sure.
I don't really charge for the manual therapy because it's part of the process. It's not the only thing.
Right,
So,
right. Short of people, clinicians in Texas, SLPs in Texas, are able to build time codes now. But the rest of the country, so far as I know, you are basically lumping this, not lumping, but this work is just a subsection of your normal codes that you bill, correct?
correct. Yeah.
Yeah, yeah. Okay, great, great.
But
So
I don't feel like I'm infringing upon the physical therapy scope. And that when I first
right,
entered the room, the very first time 2 years ago, I was like, wait, am I allowed to do this as a speech
yeah,
therapist? Am I,
yeah,
and then I see, yeah, we're doing tongue stuff for swallowing. We're doing, this is part of the voice. Now, I'm not going to
Yeah.
be doing uh, like a weightlifting regime to work on their posture, but
Right.
I might apply some of the physical therapy work and showing my people how to apply it together.
Yeah.
Like, for
Yeah.
example, I have someone who does not have the core support from the pelvic floor, and we worked on a like lean back and feel this engage, and then I had her work on a oh, so kind of a reverse plank, but
Yeah.
like
Yeah.
sitting.
There you go.
Yeah.
Yeah. Again, I love listening to how people sort of blend and adapt this work and all the other works to work together. Yeah.
Mhm.
Very cool. What about the tongue work? Have you found that helpful?
I do have some of my favorite tongue work before I go to your tongue work, believe it or
Okay.
not.
Yep.
One of
Yep.
my favorites are just lingual stretches. And one of them, if I had a straw, would be having the tongue wrap
Hmm.
around the straw. But they're also inspired by the work of that you did the other day of having them force the tongue up against the roof of the mouth.
Yeah.
So it's that, but I have them going for the forward burrito roll that
Hmm.
you
Hmm.
have and incorporating that. So that's one of my favorites, as that tends to people have a lot of tension up here.
Yeah.
And
Yeah.
mhm.
I think it's interesting too, the feedback that I've gotten recently from some of that resistive tongue work, not just for voice and tongue tension, but its contribution to working with some swallowing disorders. That's
Abs
really, really good information for me to hear
oh,
from people.
yeah. And
Yeah.
with the laryngology team, I do have oral cancer patients, and they will like they try to focus on I'm their voice specialist, so they want to mostly have voice come to me, but then one of their swallowing people, they do send them to me too. And I absolutely the new tongue stuff that you have brought up, like that push
Right.
down
Right.
real low. I am absolutely going to be incorporating that when I have more of my swallowing patients coming.
Yeah. There's in the some of the social media communities that I hang around with, the concept of the tool belt is one that's really frowned upon. Another tool for the tool belt, and there's sort of a pragmatic way of they'll sort of criticize it that if you lack a core foundation of understanding that all the tools in the world don't matter, but yet for a lot of people, having another tool is exceedingly useful because some patients are very touch oriented.
Mhm.
Others are very exercise oriented and are very cognitive oriented. And I just think having more than one approach or tool, if you want to
Yeah.
call it that, it's not that you're going to always rely on that tool, but if, it gives me a chance to have a better chance to reach you. Who are you as an
Mhm.
individual? Do you respond to touch? Do you respond to this or that, another thing
Mhm.
versus, this is the best thing since sliced bread. It's not, it's just a wonderful building block for to add to those tools so we can affect someone.
Absolutely. And as far as having more tools in your toolbox, if the tools are relevant and applicable, then I would be happy to have a different device to use. It's what I would think is the most important about this toolbox is you don't need to have everything under the sun, but if you find that there's an area that you could contribute more or that you're lacking, I would say go out there and get that tool
Yeah.
because I could be doing Masako or Mendelssohn all day, but if my person has reached their maximum resistance, then I'm kind of okay. Now what? Or the
Hmm.
supraglottic swallow. But now I have this one too. I will apply a new level of pressure and resistance. I see that only helping. But you need to understand and be able to put those kind of spider webs together. How does this link and apply? And fundamentally, what am I trying to accomplish? Not just to
Yeah.
go in there blindly with your tool. And
Yeah.
that's on us to figure out. So, yeah.
Yeah. Did you struggle at all with the rather abstract way that I look at this, that it's not just about what we're doing right here, right? It's what we're doing when we touch here to affect that whole person. Because I know that's probably one of the biggest struggles that people talk about is the vagueness of my approach when it comes to traditional soft tissue treatments. Did you
Mhm.
struggle with that at all?
I did not. Maybe when I first entered the room, but then as I saw throughout the session, it's again, you don't just treat the diagnosis, you treat
Hmm.
the symptoms. And if this is helping radiate to like a pain behind the jaw, okay, let's work with that. There, but then
Hmm.
also you think about like the anatomical structure. We have we have muscles and ligaments that connect from here to here.
Hmm.
So that's what I'm targeting, and that houses my swallowing and my voice.
Yeah.
So
Good.
that
Yeah.
each person has symptoms that can be explored through different areas. Like this could also target that jaw, but then you could do the intraoral work that could be targeting that jaw. But then you could also
Yeah.
do some tongue work, which could be either tongue really held with tightness back in that jaw. So that vagueness is actually giving you freedom to be flexible.
Yeah.
And as SLPs, I find that in our education, it's a lot of black and white specifically, because like this exercise is just for this, for when you do the Masako, it targets this and just this and that. But no part of our body can we isolate from the pieces next to it.
Right. Yeah. And
If
we're
I'm
not
wrong,
treat.
let me know,
Yes.
but there's
No, we're
something
not.
attached to something else.
Yeah. And we're not treating a muscle. We're treating a person that houses that muscle. Right.
And sometimes you'll get that person who says that they can't swallow because their nose is stuffed up. And you have to you I find it that like, yeah, okay, I will respect what you have to say, but let me also tell you this. But they might really, really believe that because their nose is stuffed up, they can't swallow. But you can
Yeah.
just meet the person where they're at and kind of guide them. But then you have some people who just they're stuck.
It's about honoring their perspective too, instead of
Exactly.
making it our. We're the ones with the expert opinion of the right
Mhm.
perspective. So yeah,
We're there for
very
the
nice.
person.
Yeah. Yeah. All right. Anything else you want to share on this peer-to-peer series here?
I would like to say that it is worth going a second time.
Mm.
I went more than once. The first time as a participant, the second time as your assistant. But the amount of care that you put into making sure that everyone really understands, and things evolve over time, and so does your education on the subject and what you have applied and what you've seen. So if anyone's considered that advanced course, I would say that it's definitely worth it. If you found value in this, the second time is definitely, it just makes you feel more strong and secure. And then if you look to mentor other speech language pathologists as like a CF supervisor, then you should feel really confident in showing some of the methods and approaches that you have given us.
Oh, great. All right, Caitlin. Well, thanks so much for taking some time out of your day to share everything with my audience.
Yeah, it's been a pleasure.
All right. Take care.
You too.